So, hello Miss, I am Plaza Kenshi and I am the first reporter of the chapter 14, the topic of the evaluation. So, when we say evaluation, it is the final component of education process, nursing process, and decision-making process. So, because of this process are cyclic, so evaluation serves as the bridge at the end of the one process that guides direction to the next process. So, evaluation. Gathering, summarizing, interpreting, and using data to determine the extent to which an action was successful. A systematic process which the worth or value or something, in this case teaching and learning, is judged. So, evaluation are not intended to be generalizable but are conducted to determine the effectiveness and specific intervention in specific settings which an identified individual or group. So, di ba, kabalo naman ta sa ADPAI, mao ni siya ang pinakalas nga kuan. Ang evaluation ang pinakalas. Kay sa evaluation, dira na makuan ang outcome sa kung nag-work ba ang katong nursing process, at nag-work ba ang katong assessment, diagnosis, planning, implementation. So, what is the relationship between evaluation and the evidence-based practice and practice-based evidence? So, evidence-based practice. So, when we say evidence-based practice, it aims to provide most effective care that is available with the aim of improving patient outcomes. So, evidence-based practice has evolved and expanded over decades, can be defined as the conscientious use of current-based evidence in making decisions about patient care. It includes results of systematically conducted evaluation from the researchers. So next is the practice-based evidence. When we say practice-based evidence, it is a range of treatment approach and support that are derived from the supportive of the positive culture of the local society and traditions. So practice-based evidence is just the beginning to define and includes results of systematically conducted evaluation from practice and clinical experience rather than from the researches. So what is the difference between assessment and evaluation? When we say assessment, it is the input, and the evaluation, it is the output. Determining the focus of evaluation. We have five determining focus of evaluation: the audience, the purpose, question, and the scope. And the last one is the resource. So, step 1 of focus of evaluation. RCE evaluation model. RCE model places 5 basic types of evaluation in related to the one another based of purpose related question, scope, and resource component of the evaluation. These are the 5 leading examples of the complex. So we have the table here. So that's the RCE evaluation model. We have the impact, outcome, content, process, and the total program. So process formative evaluation. Process to make adjustment as soon as needed during the education process. Then the scope is the limited to specific learning experience, frequent, concurrent with learning. So the content, so that's the process formative evaluation. Next is the content evaluation. So ang purpose is to determine whether the learners have to acquire knowledge and skills just taught. So the scope is limited to specific learning experience and objectives immediately as after education completed, short term. So the outcome, the third summative evaluation. So, purpose, to determine effects of teaching. Ang scope niya kay broader scope, more long-term, and less frequent than content evaluation. So, the fourth is the impact evaluation. Ang purpose is to determine relative effects of the education on constitution or community. So, ang scope is broad, complex, sophisticated, long-term, occurs frequently. So, the last is the total program evaluation. Purpose is to determine extent to which total program meets exceed long-term goals. Scope is to broad the long-term, strategic, lengthy, therefore conducted infrequently. So, that's the end of my report.
Good day, Miss. I am Sarah Grace Taya, and now I will be discuss the impact evaluation. So the impact evaluation is to determine the relative effect of education on the institution of community, and it has a purpose to obtain the information that will help to decide whether continuing educational activities is worth its cost. For example, the outcome evaluation is nag-focus lang siya sa specific teaching result in achievement of the specific outcome. Then, the impact evaluation is the impact evaluation is beyond the outcomes. So, in other words, the outcome evaluation that focus on learning objectives. Nag-focus siya on a learning objective. Total program, it has a purpose to determine the extent to which all activities for an entire department or program over the specified time met or exceed the goal originally established. So it is generally focusing on overall goal rather than the specific learning objectives, and usually focusing on the learner and the teacher and the educational activities. Educators can design an evaluation within the framework or boundaries already established by focusing on evaluation appropriately. And there are three interrelated components of a evaluation design. So these are the structure, methods, and instrument. Evaluation versus research. So research is evaluation and research are not synonymous, but they are related activities. The primary difference between the two has a purpose for conducting the evaluation of study. The purpose of evaluation is to measure whether a practice change is effective. So audience is specific to a single person, audience, institution, or the location, and conducted to make decision in specific setting. Focuses on need of primary audience, time constrained by urgency of decision to make. Research is audience generic, conducted generate a new knowledge and or expand existing knowledge, or focuses on sample representativeness, generalizability of finding, then time constrained by studying founding. So when we say research, tanang students is makaagi jud aning research, and so nakabalo na ta unsa ang research. So mo ni siya ang gapalawak sa kaisipan sa isa ka learner. Then mag-ano jud ka, maggahin kag time to study. Evaluation method um, provides the basic for determining what evaluation method should be used to collect data. And na siya following questions to assist sa pag pag conduct a conduct a particular evaluation, particular setting, and for a specific purpose. So first is which type of data will be collected, what data will be collected, and from whom. Then the third is how, when, and where will data will be collected. And the last is who will collect the data. Types of data to collect. So, about the people can be classified as demographic. So, demographic, the age, gender, health status. Then, as well as the cognitive, affective, or psychomotor behaviors, and the types of data that are collected about educational activities or programs generally include like factor as cost, number of educators, required teaching learning method. So the amount and type of materials required, and so how, when, and where to collect data. So there are methods for how data can be collected. So the first natong buhaton is to observe, mag-observe ka, then interview, give the questionnaire or written examination, then record review, then secondary analysis. So there are three categories of barriers to conducting an evaluation. So first is clarity. So the lack of clarity is ano siya kanang situation or information nga dili siya klaro or unclear. So there are best solution of the lack clarity is to provide clarity or kanang recall the evaluation focuses. Next is lack of ability. So lack of ability kanang ano siya, kakulangan ng kanang negative gali siya nga kakulangan ng knowledge, confident, and interest. Para ma-resolve ang lack of knowledge is dapat mag-think positive and maging kay nabasa na ako sa book na siya nga remember the patient care is a team activity. So if the patient daw is kanang need to learn how to katong crutches gali kung unsaon paglakaw, pwede ka mag mag-ask og help sa mag-request og mag-ask og help sa physical therapist niya or sa mga experts. So dapat lang na maging positive, then so ang last is fear of punishment or loss of self-esteem. So ni siya kanang afraid of judgment na judgment sa ubang tao.
Good day, Miss, everyone. So let's continue the discussion about the evaluation of healthcare education. The topic is all about the conducting the evaluation. This topic is all about as a nursing educator or as a nurse educator, we must conduct research so that we can evaluate the understanding of our clients or our respondents. So, conducting a research, the evaluation depends on how we carefully and thoroughly evaluate our plan and how we carefully use the instrument for data collection that we've selected or developed. So, these two factors do not or cannot always add successful to our evaluation. But, to minimize these circumstances or unexpected events, there are methods that helps to or adds to the successful achievements of the process. First is conduct a pilot test. Second, include the time to complete all the evaluation steps. And third is keep a sense of humor throughout the experiences. Conduct a pilot test or run a pilot test as a nurse educator or we conduct a research. We must run a test so that we can assess the reliability, the validity, the interpretability, and feasibility of those instruments that we use to conduct or helps our research. Next is include extra time to complete all the evaluation steps. Is that sa atuang research is that we must be prepared for other or some instances just like delays kay dili man sa tanang panahon is ma-organize jud siya. Na jud siya yung mga instances nga maka-cause of delay. Just like may mga surprises nga mga events nga kuan sa to ang maka-add siya og time. So, therefore, we must add more time as needed para makuha na to ang ato ang desired outcomes or desired output sa ato ang research. And this will add meaningful and useful to our audience. Next is keep a sense of humor throughout the experiences. Delays not likely occur but also likely to cap up inconvenient delays throughout the evaluation. Therefore, keeping a sense of humor is vitally important. A nurse educator or an evaluator with a sense of humor is more successful at maintaining a realistic perspective on the evaluation process. It is important to acknowledge that audience with a vested interest in positive evaluation results may blame the evaluators if results are less impressive than expected. So, dapat taas jud og mga sense of humor ang mga nurse educator para sa ma-assess na to ang ato ang conducted research. Next is analyzing and interpreting the data collected. So the purpose for the conducting data analysis is to organize data so that they can provide meaningful information and to provide answer to evaluate questions. Data and informations are different from each other. Data is a collection of a mass of numbers or a mass of comments do not become information until they have been organized into coherent tables, graphs, or categories that relevant to the purpose for conducting the evaluation. So, mo to siyang difference sa atoang data and information. Data is a mass collection of numbers or comments, and the information is mo na to siya ang ma-organize na to as tables, mga graphs, and categories mo na siya ang na-gather na nato nga information. So, the research, there are two types, a qualitative and quantitative. So, qualitative is talk about the quality and the quantitative is about the quantity. So, the data can be described as continuous data or discrete data. When we say continuous, it is changeable or pwede siya ma-change just like the age and the level of anxiety. Di ba maano na to kay mag-change jud ang age sa katao. So 20 siya karon, the next year mag-add and so on and so forth. The level of anxiety, dili pa siya makaya pa siya ma-cure, and then ano na siya into depression. So yun na ang mga continuous data, changeable. While the discrete data is kanang consistent, dili siya ma-change, nag-ano siya, just like the gender and the diagnosis. So sa gender, male and female, and the diagnosis is just like kanang mga hospital diagnosis natin. So a useful suggestion for deciding how data will analyze is to enlist the assistance of someone with experience in data analysis. So dili tama, as a nurse educator, we must seek help to those na-experience nga tao, syempre, then para po maalalayan ta sa ato ang analyzing the data, just like the statistician, okay? So kana sila ang nag-evaluate or nag-analyze sa ato ang mga nakuha or nag-gather na mga information or data para makita nato kung unsa ka successful ang ato ang research. Okay? As a nurse educator, we encourage to enlist the assistance of an expert statistician to assist the data analysis and interpretation. Just like what I said earlier, nga makahelp na siya para sa ato ang data interpretation and data analysis. So next is for the reporting the evaluation results. It is important, importante siya sa ato para mahibalan jud kung unsa ka effective ang ato ang research or ato ang mga gi-conduct nga mga evaluation. But there are instances nga dili gina-report or dili nila gina-show ang report. So naadri ang 4 reasons. The 4 reasons why evaluation data never make to spread the spreadsheet to the customer. First is the ignorance of who received the results. Kaya some people or some underestimate the capability of an individual, believe that the results are not important or will not be used. So there are some instances another, so nga baliwala lang siya kay abi nila o dili siya makatabang nga result. Next is the lack of ability to translate findings into language useful in producing a final report. Next is the fear that the results will be misused. So kana siya kanang naay mga fearfulness ang mga some researchers na dili siya magamit sa tama ang result. So that's why that's the 4 reasons nganong dili ginapakita ang mga results sa evaluation. So here there's guidelines that increase the results of the evaluation will be reported to an appropriate individuals or groups in a timely manner and in usable form. And so first is focus on the audience. Dili as a evaluator or a researcher, we must focus on our audience. Kaya nga naman, kay sila man ang ato ang respondent, ang client, ang mga maghatag sa ato ang answer sa atong data. Kay dili man ta makapataka og answer lang sa atong data og magpataka og gamit og sa ilang names sa mga information kay can cause na siya og some other cases na. So pwede ka ma-file og mga cases or government cases. So the purpose for conducting an evaluation is provide information for decision making in our audience. The report of evaluation results therefore must be consistent with that purpose. The abstract that is no longer that one page. So next is the format and language that the audience can understand and use without additional interpretation. And the The researchers or evaluators should make every effort to present results in person as well as in writing. So, as a researcher, dili man tinapulan, ha. So, dili dapat be attentive and be knowledgeable in every aspect of our daily living. Giving specific recommendations may increase the likelihood that the results of evaluation actually will be useful. So, next is the stick to the evaluation purpose. Evaluators should keep the main body of an evaluation report focused on information that fulfills the purpose for conducting the evaluation. The main aspects of how the evaluation was conducted and answers to questions asked also should be provided. So, as we conduct the research, we must focus on the audience, then mag-stick ta sa ato ang mga purpose. Diba, purpose sa ato ang conducting the research to organize the data and the information, to analyze the information. Okay. So, dapat we must stick to that purpose para dili ta mawala sa ato ang research, sa ato ang on the process sa ato ang research conduction. Lastly is use data as intended. The evaluators should maintain consistency with the actual data when reporting and interpreting findings. So, a question not asked cannot be answered and the data not collected cannot be interpreted. So, dili ta magpataka og add og mga bisan pag gamay lang kayo na siya ka percentage sa ato ang result is maka-cause na siya og kanang dili siya maging pantay sa ato ang result. Kay di ba need na to og help sa atong statistician kay para mahimong accurate or reliable, then mahimong legible ang ato ang research conduct nga ato ang gikandak. So the discussion of any limitations of the evaluation is an important part of the evaluation report. So, knowing that evaluation results do not include data from patients below a certain educational level or physical status can help the audience realize that they cannot make decisions about those patients based on the evaluation. Discussion of limitations also provides results and being useful information for what we do the next time a similar evaluation is conducted. So, ano siya? The focus on the audience, then stick the evaluation of the purposes. So, as a nurse educator, we must be dili ta magpataka o gamit og mga information kay maka-cause na siya og mga other instances, maka-cause ng delay sa ato ang interpreting the data. Diba? Kay we must interpret the data and analyze the data or the information para makakuha ta og goal or makuha na to atong desired outcome nga makatabang siya sa ato ang mga patients. So, that's the end of my report or my presentation this day. Thank you.